about diseases of the TMJ. Introduction. TMJ is a unique bilateral joint that functions as a one unit. It receives its name from the two bones that enter into its formation, the temporal and mandibular bone. Translatory as well as rotational movements are possible. It is also called a gangliomo-arthroidal type of joint. This picture showing temporomandibular joint. Anatomy. Articular disc. It is the most important anatomical structure of the TMJ. It is a bioconcave fibrocartilaginous structure. It functions to accommodate a hinging action as well as the gliding actions, divides the joint into a larger upper compartment and a smaller lower compartment. Hinging movements take place in the lower compartment and the gliding movements take place in the upper compartments. Capsule. It is a thin sleeve of tissue completely surrounding the joint, attached above to the circumference of the mandibular fossa and the articular tubercle. It is so loose that the mandible can naturally dislocate anteriorly without damaging any fibers of the capsule. This picture showing me lateral view of one of temporomandibular ligament and joint capsule. Temporomandibular ligament, which is the major ligament, and it has two parts, an outer oblique portion and inner horizontal portion. This ligament prevents excessive retraction or moving backward of the mandible. The stylomandibular ligament and the sphenomandibular ligament, the two minor ligaments, and both ligaments are accessory and are not directly attached to any part of the joint. Medial view of temporomandibular ligaments and joint capsule showing sphenomandibular and stylomandibular ligaments. Temporomandibular joint disorders are a group of conditions that cause dysfunction and pain in the jaw joint and muscles that control jaw movement. Disorders are characterized by facial pain, limitation or deviation in the mandibular movement, hyperalgesia of the musculoskeletal system, TMJ sounds during jaw movement and function. Etiological factors of TMD. The cause of TMD are complex and multifactorial. The more common numerous factors that can contribute to TMD are predisposing factors which can increase the risk of TMD, initiating factors causing the onset of TMD, perpetuating factors that interfere with healing or enhance the progression of TMD. In the perpetuating factors, the following may be included: behavioral factors, social factors, emotional factors, cognitive factors. Signs and symptoms of TMJ disorders may include jaw discomfort or soreness, headaches, pain separating behind the eyes, in the face, shoulder, neck, and or back, a clicking or popping of the jaw, locking of the jaw, clenching or grinding of the teeth, dizziness, trismus. Clinical significance: joint noise. Arthritic degenerative disorders are thought to be the most common cause of joint noises. Palpation of the TMJ will reveal a clicking or popping sound during both opening and closing mandibular movements. Grinding or crepitus often indicates an arthritic process. Limitation of the mandibular opening may be due to reflex spasm of masticatory muscles secondary to myofascial pain dysfunction syndrome, to fibrous or bony ankylosis of the joint, or to fracture of the mandibular condyle. Jaw popping can often treated at home, especially if there is no pain or other symptoms. Jaw popping linked to such behaviors: grinding of teeth, chewing gum, nail biting, clenching of the jaw, cheek biting, cell hypermobility can result in excessive anterior movement of the jaw and the articular disc. This will result in deviation of the jaw away from the affected side. The disc can then fail to reduce on closing, open lock. Examination. The temporomandibular joints can be felt in front of or within the external acoustic meatus during movement of the mandible. Also, we can use auscultation. This picture showing TMJ examination. TMJ disorders, the developmental disorders اللي hypoplasia, hyperplasia of the condyle, degenerative osteoarthritis عندنا مثال عليها. inflammatory disorders اللي هي rheumatoid arthritis, infection arthritis, كذلك عندنا traumatic disorders اللي هي dislocation, disc displacement وankylosis. Developmental disorders نبدأ أولا بالhypoplasia of the condyle. It is low or incomplete growth of bones which is congenital or acquired. It can be unilateral or bilateral. Causes hereditary, postnatal growth disturbance, endocrine like hypothyroidism, hypopituitarism, trauma, nutritional factors like vitamin A deficiency. Clinical features: the unilateral type on an affected side, there is elongation of the body of the mandible and the flat appearance of the face. Mandible shifts towards the affected side on opening. Eruption may be delayed in case of hypoplasia of the condyle. Bilateral, there is bilateral arrest of condylar growth. There is usually symmetrical lack of growth of the mandible, which results in micrognathia with the chin protruded to about the level of the hyoid bone. Disturbance of eruption and malocclusion occurs. Radiological features: condylar process is short and tends to assume a more posterior position in the glenoid fossa. In mandible, there may be proportionate shortening of the ramus and body on the affected side. This radiographic axial section showing the unilateral hypoplasia affecting the left side. Diagnosis: clinical diagnosis, malocclusion, elongation of body of mandible on an affected side. Radiological diagnosis: size of condyle is usually easily diagnosed on radiograph. Management: surgical management commonly used in unilateral deformities are directed towards contributing bulk and increasing the length by means of bones, cartilage and soft tissue graft. Most commonly graft is costochondral rib graft. Orthodontic treatment to treat malocclusions or prosthetic procedures. Hyperplasia of the condyle: it is extensive growth of bones in congenital or acquired form and leads to asymmetry. Causes: hemifacial hypertrophy, chondroma, osteochondroma or osteoma of condyle, Paget's disease, gigantism and acromegaly. Clinical features: unilateral, there is a slowly developing destruction and enlargement of TMJ. Progressive enlargement of the mandible occurs. There is facial asymmetry and shifting of the midline of chin to the unaffected side, with resulting cross bite or open bite on the affected side. Bilateral, mandible is larger and more forward than the maxilla. Mandibular teeth are anterior to the maxillary teeth. Anterior cross bite يسموها. Obtuse mandibular angle and the sigmoid notch form an arc of a larger circle. Radiological feature: the ramus and body of the affected side of mandible are larger. The body of the bone is also elongated and enlarged in some cases. The articular eminence is shallower than the opposite normal side. This radiographic appearance of unilateral condylar hyperplasia affecting the right side. Management: during active growth, usually condylectomy. After growth cessation, orthodontics followed by surgical mandibular repositioning. Degenerative joint arthritis, like joint disease, osteoarthritis, also called an osteoarthrosis or degenerative arthritis. It is primarily a disorder of movable joints. Clinical features: pain, dull aching pain joint stiffness, limitation in mouth opening, increasing sensitivity to cold and damp, may be relieved with rest or NSAID. Radiographic findings: evidence of erosion of condyle, especially on average 6 months after the onset of TMJ pain. Density is increased as a result of sclerosis. Ellis cyst, development of lipping, shell-like extension of the anterior borders. This radiographic photo showing right side osteoarthritis affecting the condyle. Types: primary, generally described as condition due to wear and tear, is more common with increasing age. Secondary, the joint changes occur in response to recognizable local or systemic factors. Management: elimination of the cause. It includes occlusal adjustment or replacement of the missing teeth and ill-fitting prostheses, grinding, treatment of caries and periodontal disease, analgesic and anti-inflammatory drugs, physiotherapy, heat and diathermy, muscle exercises, injection of local anesthesia in the TMJ, and finally surgery like condylotomy to prevent further damage to TMJ structures. This could be of particular importance for patients with satisfactory response to more satisfactory responses to more conservative treatment, or we could use other surgery, which is temporomandibular hemiarthroplasty with metal fossa eminence prosthesis. Provides predictable and satisfactory results in patients operated upon for advanced osteoarthritis. Thank you.